Now we'll like to call Dr. Parthasarthi Roy. Dr. Parthasarthi is here. He is a ratified member of AIOS and he'll be speaking on breakdown of natural defense residing in Meibomian fats is the cause of seasonal trends of coronavirus infection. Dr.
Hi.
Parthasarthi.
Hi everybody, good morning. I am Dr. Parthasarthi Roy. I'll be talking about my invention breakdown of natural defense residing in Meibomian fats is the cause of seasonal trends of coronavirus infection. I have no financial interest to disclose. In India, coronavirus infection had shown seasonal trend. First and second waves both started in winter months. Similar winter trends were also observed worldwide. This led me to search for the cause of this seasonal trend of coronavirus infection. I hypothesized that there is an inbuilt protective mechanism lying within the inbuilt mechanism against coronavirus infection, and breakdown of that protective mechanism in the winter facilitated outbreak of the pandemic. There is a great reserve of fat in the Meibomian glands. Base hydrolysis of these fats under appropriate temperature and moisture may produce soap to take care of virus by lysis of its lipid envelope. Besides, commensals like Staph aureus, Staph epidermidis, Propionibacterium acne break down Meibomian lipids to free fatty acids, which by neutralization reaction in alkaline tears produce carboxylate ions, which act as soaps. Vestibule of nose gets a good complement of this soap from tears drained from eyes via inferior meatus. Meibomian gland secretion has a melting point of 35 degrees Celsius, and at 15 to 17 degrees Celsius it stops flowing. It is a proven fact that bile salts present in the lumen of small intestine can destroy also lipid envelope of coronavirus, thus restrict its entry through gastrointestinal route. After conjoint reading of all these facts, I developed the following hypothesis: that there is an inbuilt protective mechanism. Visible soap formation in blepharitis is probably due to excessive bacterial lipase activity, but in normal condition there is still invisible soap formation in tears due to lipolytic enzymatic activity of commensal bacteria, which can kill coronavirus. In winter months, meibomian flow from meibomian gland is diminished, thus jeopardize the defense mechanism. Therefore, our aim is to see whether flow of meibomian secretion is reduced in November-December month. We thus initiated a pilot study comprises of 8 normal subjects, 3 males and 5 females between 28 to 30 years, and took serial readings of pH, temperature of conjunctival sac and environmental humidity, and compared them to the degree of plugging of meibomian duct orifice and degree of obstruction of meibomian flow. pH of the cul-de-sac remained 8 for all subjects for all seasons. In first 3 seasons, no plugging of duct orifices and blockage of meibum expression was seen in any subjects. In November-December data, 5 out of 8 subjects showed grade 2 plugging of meibomian duct, and these 5 out of these 5 subjects, 4 cases had grade 1 case had grade 2 obstruction of meibomian expression. Therefore, in November-December, due to reduction of environmental humidity and decrease in cul-de-sac temperature, in comparison to other 3 seasons, blockage of meibomian flow occurred. This is the now. Our conclusion is there was obstruction to the meibomian flow, thus serious jeopardization of the protection against coronavirus infection occurred due to the delayed availability of soap forming fat in the tears, making subjects susceptible to infection. Thank you, sir.
Thank you. Any questions, please?
What will be the clinical significance as regards the coronavirus infection is concerned?
Actually, in the worldwide, it is found that in winter it happens, and winter what happens, the Meibomian duct are clogged, and there is less flow of meibum into the conjunctival sac, so there is.
We agree with your hypothesis. We agree with the hypothesis, and we also find and report, it is reported that the incidence of blepharitis is more in winter. However, two things which are striking us is, what is the relation between this and corona, one thing, and second thing, it is all right to report that there will be solidification of the sebum in Meibomian gland secretion in countries where the temperature drops down considerably. But from the part of India from where you are hailing and you have done the study, even in the winter, the temperature cannot go below, say.
But whatever the temperature dips down, it has been proved that it has a significant effect on the Meibomian gland, so that the secretion is less, and that less secretion causes less soap formation, and so the lipid membrane which has had effect on it.
Why I asked you this question is, whatever temperatures you have reported, they are fine for the Western thing, but in our scenario, I have got blepharitis, and I can say 1 month down the line, winter is going to set in, because the blepharitis sets in. So I agree with you, and now your correlation with corona?
Actually, the blepharitis is a separate entity. I am not talking about the blepharitis.
We are talking about this relation with corona.
The relationship with corona is that in the winter months there is less meibum is available in the conjunctival sac. So there is may not be visible, but in the microscopical level there is soap formation, and that soap is taking care of the coronavirus by lysis of its lipid membrane. But when the winter sets in, all the other seasons this is happening, but in the winter season, as the fat is less this is one of the reasons that these tears go to the vestibule of the nose and is playing a part in the causation of the corona in the winter. And apart from that, as it is beyond my scope, there is this T zone of the face. Here also there are sebum glands. This sebum is secreted and is there, so much of sebum in the nasal vestibule. That also takes place.
Thank you, sir. We'll move on to the next.
Prevention.
I'd like to request Anand sir to please give a certificate to Dr. Partha Sarthi, please. I'd like to request Dinesh sir to please give a certificate to Dr. Prithvi Chandrakant. I'd like to request Dr. Manisha Agarwal to please give a certificate to Dr. Anjali Khadia. And I'd like to call the next speaker, Dr. Virangi Doshi. Dr. Virangi is here.